we started bringing in medical students and became more administration at that point, and then I became the quality director for the North region, and again began to learn more and more about the flow of money in healthcare, and that's really what opened my eyes to what's going on. So I was watching that happen and saying, gosh, what is going on here with, with all these billions of dollars flowing around and everybody's so dissatisfied. My patients are dissatisfied. The outpatient clinic experience for a physician is very, very dissatisfying. And I said, who the heck is going to change any of this? Where's this all heading? And this is where my personality kind of starts to get involved. I've always been kind of a get in the weeds kind of guy and try to figure things out and try to find where the problem is, because I would have patients come in that were, they'd be business owners. They say, I can't afford health care for my employees. The employees would come in and say, I can't afford any of this. I can't afford what you're doing. And then I'm looking at all the doctors around me, they're all miserable. And I started thinking, gosh, 30 years ago, you couldn't get an internist to quit. You couldn't get an internist to quit their job. They wanted to work until they were 70 years old. They loved it. They loved their patients. They loved their job. And now people are leaving in their 50s because they just hate it. They just hate their job. And this is all wrong here. So that's what started customized healthcare. As I said, something has got to change here. And I said, why don't I try putting a little side project together and see if I can figure out how to fix healthcare on a small level and just see what I can do. And so that's how I started this, and started networking, started talking with insurance people, because I realized right away I was going to have to learn a ton about insurance, particularly how insurance is bought and sold to large organizations. That's what I really wanted to find out, because to me, that seemed to be where the problem was. So I started looking into that, started getting to know insurance people. And what I found out really quickly is there's no books on this. You really got to learn this stuff by hanging out with these people and finding out what they do. And they kind of tell you how they do it and where it comes from and what their motivations are. And that's when I started to find out that, as everyone in this world finds out, Josh and Steve included, that the real problem with healthcare is everybody starts confusing insurance with healthcare. And that's the big problem, is that everyone keeps thinking that, well, I've got insurance, that means I have healthcare. And as we're finding out, you can have all the insurance in the world, and that doesn't mean you're getting any healthcare at all. You're just spending a lot of money. And so I kind of got into this world now where I started running into people like Josh and Steve, started running into doctors that were pulling out of the hospital systems and saying, I want to fix things too. I want to try to fix this. What can we do? And you start to realize that what's going to solve the healthcare problem is to get away from this idea that everything has to run through insurance. And if you start reintroducing market-based principles into healthcare, things are going to get better. And it's the concept of just pushing insurance back into an insurance role where it belongs, and then trying to do as much market-based as you can. And market-based means quality and price, like anything. It doesn't matter whether you're talking hamburgers or tires or healthcare. When you reintroduce market-based principles into anything, you're going to start seeing quality and price move in the right direction rather than the wrong direction. So that's what led to customized healthcare. It's just trying to figure out why doctors were so miserable, B, trying to figure out why my patients were miserable, and C, trying to figure out why all these businesses and organizations were miserable and angry, very angry about it. So I don't know, that's how I kind of started with, and it just starts to grow. And that's what I hope we talk about, how we're doing this.